Good morning, Jess.
Good morning. How are you?
Doing good. How are you?
I'm good. I'm good. Is it Friday?
It looks awesome. Did you know that?
Huh?
Your hair.
Before we get to the official 10 o'clock, B, did you receive my request by email?
Or yes.
Just this morning about just adjusting my time on the agenda.
No, I didn't.
Okay.
Well, I may have received it, but I didn't read it.
Fair enough.
Hello, so everyone. You want to go earlier? Is that it?
Yes, I was just going to ask if we can adjust the agenda so that I can get back to this meeting.
So when would you like to?
Well, I thought at the I would do it between public comments and information items.
Okay.
And then I will stay on as long as I can, but I'd like the opportunity to share some things from my end. So
sounds good.
We'll have to still make that official after we begin. So.
Right.
Hello, everybody.
Hi.
Hello.
This is Chris Larson.
Gloria Brooks.
Hi, Chris. Do you have video?
I do, but I am not turning it on right now. I have a workman behind me in my kitchen, and you probably don't want to see what's going on.
Okay. Can someone help me with attendance? I don't have a list of members in front of me.
Yeah, so what we'll do is we'll have Jess Bechtel do a member roll call.
Okay.
And then she will actually anyone outside of membership or staff, she'll just record, and we'll have Melissa on here doing that as well. So we'll have plenty of backup and can get right into the meeting. Jess will also be our moderator to manage sound and video, etc. So just as a reminder, though, if you are not speaking, we just ask that you mute your system so that we don't have feedback or extraneous noises. And we'll let B kick that off. It's 10 o'clock.
Is it 10 o'clock? All right. Well, as you can see, I'm not Dixie, but I'll be chairing the meeting today as first vice chair. Dixie's unable to be here. I'm not sure. Jody maybe can tell us what's going on, or maybe she's just.
I don't. She just alerted us that she would not be able to be in attendance today or at a meeting we had last week. So.
Okay. Well, then let Jessica go ahead and do roll call.
All right. So I'm just going to go down the participants list and then name off everybody. I see we have a big group, it looks like, today. So I see, and then what I'll do is name off everyone that I do see. And then if I don't call your name and you're a committee member, then just let me know and I'll record it. All right. So I see B, Jody, Chris, Joanne, Marilyn, Wendy, Jen, Joyce, Kathy, Marilyn, Dave. Are there any other actual committee members that I did not call? All right.
Joe Ruth is here. Did you get Joe?
Yes, got Joe.
Okay, great. Thank you.
All right. So that's the attendance for that. And then it looks like we have a handful of guest speakers with us today. Just remember, if you're presenting, to be very clear, precise. Some people only call in and so they don't have the visual to see what you're talking about. Make sure if you're making any motions, anything like that, to state your name beforehand. It makes it easier for those taking the minutes. And if you are not talking, then go ahead and pause yourself so that we don't get any feedback. I hand it back to B.
All right. So, and I believe given all those numbers, we have a quorum. Is that correct? Yes. Okay. So the next item of business is the agenda. Jody is asking for one small change that is to be moved up after public comments. Are there any other changes to the agenda? Hearing none. Also, we'll do it like Dixie did last time. She did both agenda and minutes together. Are there any changes to the minutes that need to be made? Hearing none, may I have a motion to approve both the agenda and the minutes?
I motion Chris Larson. The agenda and minutes be approved.
And I'll second it.
And who was that?
That was Wendy.
Thank you. So it's been moved and seconded to approve the agenda and the minutes. All those in favor say aye.
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 Those opposed say nay. The agenda and minutes have been approved. We are now moving on to public comments. And Lisa Wise, is she here or?
I am
Yes,
here.
Madam Chair.
There you are.
Madam
I
Vice
see you.
Chair. Thank you, Madam Vice Chair. I would like to introduce our two public comment speakers. Just a reminder, Lisa and Jennifer, you have about 3 minutes under public comments. We are moving into some new, we as the AAA and PPACG are moving into some new community information and outreach. And we have Lisa from Brookdale Senior Living and Jennifer Horn, our newest staff member here at PPAAA, to share just a few minutes apiece about some of the programs that they're going to be working on. So with that, Lisa, would you speak first for us?
Absolutely. Can you hear me okay, everyone?
Yes.
Hi. Yeah, so I'm very excited. I wanted to share with you all, well, first of all, congratulations, Jennifer. Super excited for you. I wanted to spotlight this month. I am holding a CE education course that I really feel is very beneficial for the community at large in regards to seniors and the LGBT older adults. So I have a class that I would love to invite you all to. It is going to be taking place next Tuesday on June 30th from 1 p.m. to 2 p.m. If you don't need CE credits, that's fine too. If you do, you can definitely see if it's approved. But I just wanted to kind of go through what it is about. And a couple of you attended, and thank you so much. You saw the value in it, and that's why I'm here today, just to share a little bit and give another invite with the popular demand of this important information. So one thing that we're going to cover is identifying 3 current best practices for creating services welcoming to the LGBT older adults. Another thing is discussing current research at the intersection of aging as an LGBT person and dementia, and also just dispelling the myths about people with HIV and identifying best practices for working with older people with HIV or AIDS. And lastly, just plan for the unique needs of the LGBT baby boomers and including programming and expectations around staff training. I would like to ask, I'll put it in the chat. I'll give you my email and cell phone number, but just shoot me an email, and Kent has my email as well if you would like to attend, and then I can send you the Zoom invite. And again, that is next Tuesday from 1 to 2. Thanks, everyone.
Thank you, Lisa. Jennifer, I'll ask that you go ahead next. And my apologies, my screen has decided to act funny. That's the love and joy of technology these days. But Jennifer, I'll just introduce briefly. Jennifer Horn actually served for the last 9 months or so as the intern for the Family Caregiver Support Center here at PPAAA. She has just done a fantastic job in bringing her background and knowledge into the program. Works great with all of our staff, but of course in particular with Kent Matthews, the director of the program, as well as Michelle Imborski, the other coordinator. I will say that there's a lot to be said when an organization and a program hires the last 3 of its interns. We have come to love Jennifer as a member of the staff and what she provides for the PPAAA, and we have some exciting opportunities to reach some underserved members of our community with some programs that she began researching during her internship. So she's been with us now about a week and a half, officially as an employee, but her commitment was so real that even between the time of her internship until we were able to go through the hiring process, she also volunteered with the Family Caregiver Support Center. So we're very proud and excited to have Jennifer on now as a part-time member of our staff to continue the great work and future work. So Jennifer, if you will, about 3 minutes, would you share with us some of the program plans?
Hi, everybody. Can you hear me okay?
Yes.
Okay. I'm Jennifer Horn, and as Jody said, I was the intern, and I recently graduated from Newman University with my Master's of Social Work. My focus is LGBT Asian population, and I did have a resource list of contact information and websites for the LGBT aging community. So I would just ask that if you do have access to that website, to that resource list, that if you know anybody in the community, to go ahead and distribute that to them and let them know that there are allies within the agency that can support and assist with their caregiver needs. So my goal is to eventually develop and implement a training program for the staff and long-term care facilities to include the sensitivity training with LGBT aging, since it is a unique population. And as Lisa mentioned, the baby boomer population is only getting larger. So that is the goal, is to kind of just reach out more and be more inclusive with the LGBT aging. Thank you.
Thank you so much, Jennifer. We appreciate that. B, if I may, I will go ahead and give my report so you can take me off of section 4D, and then I will continue on listening before I have to rejoin my meeting. So thank you so much, everyone, for being here. We have been through some very exciting times, as you might imagine. Those of you with ASRAC chairs, and as well as our providers. It's a different world from the time we started having these conversations about what changes might need to look like, all the way back in late February until this time. We, as you know, and as I've reported, we've received two emergency funding packages. The first was to be used by the end of this month, and we will fulfill that obligation from the ACL, that's the Administration on Community Living, that oversees the Older Americans Act funding and processes. We will also have we have also now received a portion of the CARES Act funding. And as you know, with the state budget shortfalls that were in process of being balanced, there were some real concerns about what the overall state budget might look like as it related to Older Americans Act service provision across the state. So a little update for that. Early on, it looked, well, just really bad. We were estimating over $1 million loss of services, service funding, which accounts for nearly a quarter of our overall annual budget. The legislators and the work by the State Unit on Aging and others who work with the legislators around senior services worked diligently to express the need to not cut the funding that would affect our services. There will be an overall reduction in the funds that we receive from the state in this coming year. However, it's not nearly as drastic as originally expected. It will be about a fifth of what we expected. And so we will have the opportunity to make up that budget shortfall by using and accessing some of the CARES Act emergency funding. With that being said, the next 2 months, July and August, we will not receive any state funding. The state is going into its own holdover period for the contracts and will not be providing any state funding at all. So that's zero, no funding from the state. We internally staff, our finance department, myself, we have created a plan and it's in process, working with the providers. The providers have received notice from us as well that in July and August, they will receive 1/6 of their original state fiscal year 1920 funding base amount. That does not include emergency funding or any carryover that they may have been allocated back in January. What this simply means is that they will have a very base number to work from in July and August. Once the state resumes their contract period, September 1, we will receive the new state contract funding amount as well as our federal funding, and we'll be able to move forward and still have access to the CARES Act funding. So in July and August, providers will be working from a mixed pot of funds, as it were, a portion that will be pulled back at the end of June. Unused funds will go back into that pot and redistributed, and we will make that up with some federal carryover funds as well as accessing as needed our CARES Act emergency funds. We're confident that base services will continue and some emergency provision will be accessible, and I'm working with all of our providers right now to determine those additional needs and expected fund usages during July and August. As you know, our RFP process was completed. TRS subcommittee has met once. We have a lot of work to do. We will convene again very soon. They gave my staff a lot of work to do. A lot of questions came out of that meeting and a lot of discussion. And so my staff and I are working on getting those questions answered, working with our providers. If you are one of our providers and you were solicited for questions, please answer those as broadly or as specific as possible so that we can compile that information in time for our TRS subcommittee so we can wrap up that good work. We still have several approval processes to go through, but then if we can stick to our schedule, we will be able to begin fresh with contracts September 1 for the next state fiscal year. So that's where we come from the budget standpoint. Not as drastic a change as we expected, which has been a big relief for us. And so we're very excited about that and think that we feel we can move forward without having to cut any services or staffing based on those new projections. The other bit of information, as you know, just like I said, I introduced Jennifer this morning. We did make some changes within 2 of our departments. As you know, we lost a long time ombudsman back in March, and we decided to readjust that department. And so now we have 3 ombudsmen in that department focusing on that great work. And now we've added Jennifer in a part-time role to family caregiver support. So we're very excited about what that means moving forward with our programs within AAA. We also have a new staff member who will be joining us next week. Her name is Laura Kilpatrick. She comes to us from Chattanooga, Tennessee, and she will be our new mobility coordinator. You've heard me briefly touch on some conversations that we've been having with the city as well as CDOT and the Federal Transit Administration. There is funding that's currently designated to Mountain Metro Transit for their senior and paratransit work. We are going to be working on transferring those funds and the designated recipient designation from the city to PPACG and specifically PPAAA. This will also give us an opportunity to move services around, understand and direct services better, especially as it relates to seniors. And this will help us organize mobility across our region, not just in our urban areas. So this will be a great opportunity for us as an organization to receive various funding streams and to help coordinate services better throughout the region. Some of the funding we receive is very, very focused, very, very streamlined, and is meant for very specific urban areas or corridors. But having this all under one roof, as it were, under PPACG will allow us to work a little more efficiently and to help continue our partnership with our current mobility providers, as well as seek out new opportunities for mobility across our region. So that's all I have for right now. I'm open to questions, and if not, then I will hand this back to B. Well, hearing none, I guess, B, it's back to you. Thank you.
Okay, thank you, Jody. All right, so then glad to hear that the financial situation is not as dire as we anticipated. That's always good to hear. All right, we're ready for our provider presentations. I believe Jason is here from Silver Key.
Yes, I am. Thanks, B. And Dayton will be sharing his screen here pretty soon here, I believe. But while he's doing that, I'd be remiss if I didn't thank the AAA and also the RAC for the ongoing support of Silver Key's initiatives. And many people individually have been supporters of our mission. So thank you for that. Dayton, are you able to share your screen?
I am not. It says host disabled participant screening share, and I have sent a private message to Jessica so we could kind of work it out.
Okay.
Go ahead and give it a try now. See if it works.
Okay.
While he's doing that, I'll share with you that our marketing team has said to me that my gray backdrop shows no personality whatsoever. So they took the initiative to give me a Silver Key backdrop, and I see vibrant colors in all the other areas. So So forgive the backdrop, but it is something that does represent, I think, what we're trying to say, which is Silver Key is definitely part of this community and very much part of hopefully this presentation. So we're going to move forward to the next screen there, if you wouldn't mind. And so I wanted to just outline what our hopefully accomplish, being able to give you some information, and then if you have questions at the end. But we want to share with you some of the accomplishments over the last year with Silver Key, the services that we've been providing and how and who we've served. Really one of the key pieces that I want to emphasize is the resilience, not only of the organization, but of the population we serve. And I'm going to bring forward some concepts and some decision making that we have internally based on some of those factors of resilience. And then also I'll update folks on what's going on at Silver Key related to COVID and our response and what that looks like going forward. In doing so, the first thing I want to share with you is that prior to all of the COVID challenges, our board was able to have a retreat where we really did step back and try to understand from the board's perspective and also with the population we serve, did our former mission really capture the intentionality of how much and who we serve and what that looks like? And in general, the answer was yes. But there was a couple things that were brought forward that I think are helpful for you to be aware of. And actually it's italicized on the screen there in that presentation. And it was adding the word healthy. So Silver Key serves in partnership with our stakeholders to support a healthy quality of life for seniors, allowing them to age safely with dignity and independence. And many may say, well, what's the value of adding healthy into a mission? And I will tell you, there's several different key reasons why we did that and that the board had thought that this was something that made sense going forward. The first one is that Silver Key has a historical 50-year history of being a social service entity, absolutely. But when we start to think about the social determinants of health and how health is impacted, the first thing that we learn very quickly, and many of you have heard about this, is that food is medicine. And so one of the things that we work to do is make sure that people have access to quality, nutritious food, because lack of food or food insecurity translates to decay. So that was the first thing. The second kind of pillar in our work is access to medical services. So with our transportation program, the primary role that we have is making sure that people get access to the medical care that they need and deserve. Dialysis would be an example of that, even through the point of, as we move forward in our care or through COVID, we were making sure that we were delivering every essential medical appointment that we possibly could, keeping the patient safe and secure. And that was really because of our mission saying we've got to be aware that access to medical appointments is part of health. And so we were able to continue our dialysis linkage for individuals and certainly other medical care. Lastly, I'll share with you is that we know that it's difficult to be distant while connected, and we knew that that was a problem anyway for many seniors. So our health and wellness model in our services for behavioral health and case management was to ensure that we have people connected and we stay in the vein of let's make sure that people have the connections back to Silver Key for broader based needs, that we're linking them through other services. So we knew that behavioral health and the case management piece was very much part of that health model. So I'll share with you that that's why Silver Key serves in partnership with our stakeholders to support a healthy quality of life for seniors, allowing them to age safely with dignity and independence. I'm going to go ahead and turn this over to my colleague here, Dayton, to be able to move forward with some of the next presentation.
Thank you, Jason, and thank you all for having us come out and share the wonderful work that we're doing here at Silver Key and the impact that we have the privilege to do every day and in meeting the needs of our seniors of our community. And just quickly to show a visual and in an encompassing way, as Jason had alluded to, really kind of this holistic and integrated sort of model where we're ensuring that we're not plugging in only one area, but we're plugging in multiple areas for individuals and families. And these numbers here kind of show those different, show the amount of services that are being provided. And I know, Jessica, you had mentioned kind of to be intentional in some number sharing. So some that particularly that stand out to me, all of them do, but really those meal numbers, you're seeing we're breaking 6 digits there and 100,000 meals in the congregate meal area. Erica will be speaking to that a little bit later. The reassurance phone calls, we've seen some significant trends there. As Jason had said again, really attempting to stay connected while staying separate, staying safe. And we'll talk a little bit more about those pieces, but we thought we would kind of just show the numbers as they were from the beginning of this fiscal year to the current, and seeing the impact in terms of meals, rides, and hours that are being provided to our clients. And I think with that said, it's important to know who we're serving. So we created this infographic as showing kind of showing you as a council that we're being intentional in our data collection efforts on staying apprised, staying informed on who we're serving and how we serve them. Because you know, we have to be nimble on who we serve and our intentionality on how we serve. So these are a couple that show some of the demographics that we track internally, and we also report out via PeerPlace. I'm sure some of you are familiar with that platform, but we know who the age groups we're serving. You see there in that green part of the pie chart, 43% in a sample size of 7,300 clients fall within that age group of 65 to 74. What does that mean in terms of the supports needed and where we're filling those gaps as a community leader in providing services for seniors and families that they may be the head of the household of? The gender also, that is, I'm sure not very surprising to most, but it is definitely something to keep an eye on and keep apprised of. And Silver Key diversity. So again, with that sample size of near 7,300, we have an understanding of who we're serving, and so we remain culturally sensitive across all domains. Next, I'd like to go into some of the accomplishments over the past year. One of those is our Silver Line, which is our main line that the community looks to and calls to get connected to any one of Silver Key's services or to get connected to the right resource in our community. We're well connected. We are very fortunate to have such great collaborative partners, and so we know and embrace that philosophy of there being no wrong door. Regarding the Silver Line, there was some research done, actually countywide, done by Elevated Insights, that showed that Silver Key was the #1 look-to resource and when people needed or were looking for information. So we're receiving near 2,800 phone calls per month through that line. And through our initiative, through creating the Silver Line, we've been able to centralize our entire phone system, which has in turn improved client experience, increased the capacity among our direct staff who are on the front lines and providing services. And another important piece has been that we've been able to centralize our data across our programs. A lot of organizations struggle with interoperability, and so that has been a big successful outcome that we've been able to accomplish. Innovative partnerships, like I said, some great collaborators in our community. Two that of note is that with our transportation collaborators through the Fountain Valley Senior Center and Invita, who are both very reputable partners and organizations in our community. And we're looking to address one of the biggest gaps identified in our community among older adults is transportation. So how do we be those proactive organizations to be able to fill that gap for our community so seniors can get to where they need to. And then thirdly, successfully navigating the continuing COVID crisis. We've been very fortunate to have these partners and an intentional leadership in our board and team internally who have been working nonstop to strengthen our organization, whether it be logistics or strategically, to stay nimble and continue our services and meet the needs of our clients. With that said, I'm going to look to Erica to kind of speak to some of the modifications that we've made in the nutrition area. So Erica, I will hand it off to you.
Thanks, Dayton. Okay, so nice to meet everybody. I think I've met some people. The nutrition department, the purpose during the crisis is not only to provide nutritious meals, although it certainly is one of them, but it is also to address the social isolation and to strategize to meet the needs of our seniors as they weather the physical and social changes of the past few months. The home delivered meals have increased exponentially, as you've seen on the last couple of slides, during this COVID crisis, and the numbers are just tremendous. The staff and the volunteers have been amazing to help to meet these needs of our clients. The Connection Cafe specifically, we've had to completely change the model of our distribution to accommodate the needs of the community while following the public health orders. We immediately switched from cooked and served in person for the Connections Cafes to frozen meals. The Connection Cafe has a grab and go model of the weekly packs right now. The participants are able to come to pick up a pack of meals each week, minimizing the physical contact while still having the opportunity to access nutritious meals. In our meal delivery for home delivered meals and Meals on Wheels, we've been able to continue all the meal delivery. And we immediately began following the model of the 6-foot distance while still being able to have the eyes on our clients, which is really important, and having that vital visual interaction and check-in. Even if it's just a wave at the door or carefully asking how they're doing from 6 feet away or something. Because of the increase with the need and the at-risk seniors, it's prompted an increase of production in meals immensely. We have increased the need for capacity as well. So this has warranted the need for an additional extra large freezer for the proper storage of the meals, and it allows us to meet the greatest need and plan for the future. The change in the distribution model and extra precautions has also caused us to have to redeploy our staff, and as a whole new process was established. The new ways of making and presenting the food to adjust to the system. We have a new packaging and delivering way of doing things to meet the greater need of the community. And it's more than we could have really ever anticipated. So that being said, for the nutrition part, I'm gonna go ahead and move on to the transportation area. In both of our community-based services, nutrition and transportation alike, Silver Key has had to make some difficult decisions of how to serve clients with limited resources. We've all worked to be responsive to all of our seniors that need support in a variety of aspects. In the past, Silver Key has had to have a wait list across many of our programs due to those limited resources and limitations. But we're happy to announce that we've been able to completely eliminate the wait list and transportation and better meet the needs of our seniors, the current needs. When the COVID crisis began, transportation began only providing medical care as an essential service, the transportation to and from medical care. The drivers started taking extra precautions with sanitation and hygiene. The transportation department has had to adjust because of the loss of rides, but this has allowed us for extra capacity within the transportation department. And with the gracious support of AAA, Silver Key was able to pull together our resources and utilize the capacity to redeploy and deliver commodities through our other department. So transportation continues to anticipate and strategize what the services might look like as our months go on. And with the last few months and efforts behind us, Silver Key's community-based services of nutrition and transportation are looking to the future with some cautious optimism. So with that, I'll move back to Dayton for senior health and wellness services. Oh, you're muted, Dayton.
That happens at least once during every meeting. I'm pretty sure. So I was just saying just how inspiring really that work has been, especially in the transportation, to see that department really kind of redeploy, as you'd mentioned, to meet the needs in other areas. And one of those areas is our food pantry. Just this last month, we delivered to over 260 households commodities. And we're not talking, you know, lightweight stuff. We're talking about a 30-pound box of food, in addition to some of these prepackaged bags you see in that second picture there, and getting those out to the seniors who are taking those extra precautions or not at that comfort level of coming out. So we're meeting those clients where they're at in their home and ensuring that they still have access to food, and quality food at that. So we're fortunate to partner with Care and Share, where we're getting about 80,000 pounds of food. And with that, again, I point out meeting clients where they're at, because we have a multi-pronged approach in our food pantry going right now, a model where we're offering delivery, and we're offering express lane, where individuals are able to come in and pick up those prepackaged groceries and you know, have that food for the remainder of the month. It's a seamless system, it's efficient, and we did it with the intention of reducing the risk of individuals of crowding in our lobby, which was typically the case in the past when we had our client choice. But the outlook is that we will continue all three options, and it's definitely something that we're striving to meet and evaluating in terms of what resources we need in order to continue those in this new world that we're all living in. So those multi-generational households right now, we serve around 160 that are headed by grandparents. So they are looking after kiddos who are relying on, who they and their kids are relying on this food on a monthly basis, especially in times of summer, or when the school system is not really in its full functional mode and providing those meals in a typical fashion that they have in the past. So we would not be able to do any of those three things, the delivery, the client choice, or especially these pre-packaging, without our volunteers. And so we really we shed light on them and feature them in this photo because they are doing such wonderful work. And next is the case management and behavioral health. We've actually seen an uptick, and I think some of you who've probably been a part of many conversations, behavioral health is at the forefront right now in our community, especially among older adults. And that has a lot to do with the social isolation piece. It is one of the many unintended consequences that our older adults are facing as a result of us trying to be safe, keep distance, and prevent anyone being exposed to this very, frankly, this awful disease. So with that, we have not skipped a beat in ensuring that those critical services provided by case management is in place. Clients are getting connected to the resources. They're providing services every day, and our behavioral health is actually increased in need. We're seeing clients who are actually looking for that support, and our capacity through our behavioral health workers. We have licensed clinical social workers on staff, as well as other behavioral health providers who are looking to meet the needs of clients. Again, meeting them where they're at through telehealth, through the telephone, others who are willing to come into the office. So we're really being as nimble as possible, as safe as possible, and giving our clients options in those regards. Our calls of reassurance, like I said earlier, has been one of the most increased, and we've seen the most influx, that and behavioral health. And again, it could be attributed to social isolation. So those engaging in calls of reassurance are a result of those who are looking to just talk with someone, to have a lighthearted conversation, or even on the other end of the spectrum, some individuals don't have any support network. So they're worried for themselves of if anything were to happen to me, if I were to fall, if anything like that were to happen, who's going to check in on me? And so those calls of reassurance are plugging in and ensuring that our clients are safe in that regard, and also plugging in to ensure that they remain connected, and we have continuous eyes and ears in that way to ensure that they remain connected, and any resource that is identified during a conversation could be plugged in with. And again, a slide featuring our wonderful volunteers, and we truly mean they are the heart of Silver Key. The amount of work and the scale that we've been able to meet and continue to grow is a result of their aspirations, their inspirational work in stepping up in these uncertain times. You see, we included some COVID numbers there where they've really stepped up just within these COVID months, 200 additional volunteers that have equated to just amazing hours work for us. And they look to Silver Key as being one of those key places in the community to volunteer their time and talents and make a difference, because we're making a difference here every day in the services that we're providing. And it's a direct product of their work, whether it be assembling a bag or accompanying a transportation driver to deliver those commodities, or getting out to the Connections cafes and handing out the meals. So again, they just do so much for this organization, and so they definitely deserve a shout out and a spotlight because of the great work that they've been able to do for us that has allowed us to continuously meet the need of our clients. So with that being said, I will hand it off to Jason to give you some updates on our COVID and kind of where we're at now.
Where we're at now is that we continue to be able to provide all the services that we have historically. We adapted and changed very quickly, again, with the support of the AAA and the community partners. And each one of the areas that we have safe and secure, you heard that with each one of the presentation presenters talk about that. We're practicing the respiratory hygiene, hand washing hygiene protocols, making sure that we're disinfecting and cleaning any of the areas and sterilizing within the vehicles. We are ensuring that we are wearing masks with any client-facing connections with through any of our teams and volunteers. And beyond that, we are also making sure that we've got the social distancing measures in place as much as possible. I will share with you just briefly is that the first time that I heard about the COVID impact in the Silver Key system, truly the larger impact, not at the global level, but within the organization, was when one of our wards in our guardianship program had passed away. And that's where it became very real and very relevant, and it always had been. And this person was treated in one of the skilled nursing facilities. But that's where we took a very conservative stance, a very methodical stance. And actually, we've done scans from both our volunteers and staff, and we've received external surveys that had said that Silver Key had been able to meet the volunteer and the staffing communication and support system in a very positive way. So I think we really did step through after that first case. Now, beyond that, we haven't, to our knowledge, we haven't had any other loss of life or volunteers or staff or any other impact in our support system. I will share with you personally that I had a caregiver living with my father. The caregiver was an essential provider in a construction area. He contracted COVID and he passed away 2 weeks ago now as a result. And my father became COVID positive as well and was in intensive care unit for 3 weeks. And I'm grateful that he was able to leave that. And in fact, Erica's program has been able to be the bridge for me to make sure that somebody's checking on him during the day. So I will tell you, this is live, this is real, and this is very, very current for Silver Key in the population we work with. But with that, I will also say one of the lessons learned. One of the lessons learned is Silver Key cannot do this alone. We are committed through our mission about stakeholder and partnership. The dollars that we receive from AAA and from the city through the Metro Mobility, through the specialty transit, the donors that we have, all of these pieces are what we're braiding together to make sure we can serve as many seniors safely and with the core competencies that Silver Key has. And so the question is, where do we go from here? The first part of where we go from here is we've got to make sure that we're bringing enough resource to be able to meet the need. And we will continue to do whatever way we can to be able to bring that resource, never jeopardizing our mission, never doing mission creep, but staying in partnership with those entities to be able to become more effective and efficient across the board. And I will share with you that one of the things that is coming up is that we do have our 50th anniversary in the celebration that is scheduled for August 1st. Originally, this is going way back, and even there was one picture in the presentation with the volunteers. You see, we're all together, no mask. That was an early picture before COVID. At that time, what we understood Silver Key to be was about relationships. What we understood about Silver Key is about partnership. What we understood about Silver Key is that we do this together to be able to serve those that are most in need. I've got a different lesson learned that I want to share with you now, and it's about a decision point that I've made. Here's what it is. Some people have said, are you sure you should be having your 50th gala on August 1st? And I said, we have not received guidance by the federal, state, or local community that says we can't do this. Instead, what we've learned is that we do have the safety protocols, all of the pieces that I just described that are in play. But more importantly, the Department of Human Services and I are partnering together the Department of Health and Environment Services, the medical director, Dr. Robin Johnson, and I are meeting together. And what we're hopeful to do is to be able to have even an article going very soon, hopefully into the Gazette, that will outline we need to be able to be responsive to COVID. We need to be protecting ourselves for COVID. But I think Dr. Johnson would be okay with me sharing this. She had also shared with me, we have also got to be real that we're going to have to learn how to live with this. They have information and knowledge that they want to bring forward. We have a need to be able to make sure that we're moving our organization forward. And we think that partner together, that we can demonstrate through an article, not a celebration after the event, but proactively before the event and say, this is the strategies we're doing to be able to give choice for people to be virtually involved with our gala, to be live at our gala, or to be there in spirit if neither of those two work, to be able to help support the mission. The reason why, when I talked with Dr. Johnson, that I think it became very powerful in that decision-making was because the change of the focus of our gala. Our gala at the point was to celebrate our 50th. And yahoo, we should celebrate that. That's great news. But I'm taking a step back from that. And what I'm going to say is we are no longer necessarily celebrating the 50th, and we are no longer going to celebrate that we've made it through this point of COVID or in the wake of COVID. Actually, I'm stepping back and I'm saying what we are doing is we are going to celebrate the strength of the older adults and seniors we serve. And what I mean by that, I have talked with some of our seniors who've said, I am fatigued of being home and not connected. And I agree with that. There's others that have said, I know I can't go out because it's not safe for me to do so. And there's others that have said, look, I've been here, done that, got the t-shirt. I've lived through depression. I've lived through epidemics. I've lived through challenge. I've lived through the depression. And I will tell you, among all of those folks that I talk to that are in the population that we serve, it's the character of resilience and confidence. Those two things are what give us as an organization the strength to be able to be ready for the next 50 years. So the celebration at our gala is a celebration of confidence and resilience because our organization is truly pulling the characteristics from those we serve. And so I would invite you to be part of, in any way makes sense, and I will invite you to be part of supporting our organization because we truly, as it says here, appreciate the relationships needed for us to do our good work. And I will let you know that I am so blessed to be part of this organization. And the people that I work alongside are some of the most quality mission-driven folks, both in our volunteers and in our staff that I ever have had the pleasure of knowing. And it has been life-changing for me, and it gives me hope that we are going to be able to truly bring in the knowledge, wisdom, and expertise of seniors in our community differently than we ever have, because candidly, they're the ones who are stepping through with confidence and experience and wisdom that a lot of our younger population can learn from, and that is what we're going to celebrate in the next 50 years. Thank you, B. We certainly can answer any questions.
Thank you, Jason and Dayton and Erica. We really appreciated your presentation. I'm so happy to hear your father is doing well. Are there any questions coming from our Board members.
Well, I would just like to say, Jason, this is Wendy Farr. Thank you so much for that positive and upbeat comment there that you've had. I've been feeling the exact same way that so many of our seniors have that resilient nature. They're like, yeah, you know, been through it, didn't there? I like your comment of the got the t-shirt and moving on. I've had a couple of experiences the last couple of weeks with some of our community seniors where that's exactly the perspective. Yeah, they're frustrated, you know, but I think there's a lot of things that have changed, a lot of things that have been canceled, like you were saying. And I appreciate your positive energy with, yeah, but we also need to, this doesn't look like it's going to be temporary. You know, this is probably going to be a way of life for the future, and we need to adjust to that. And the way that you guys have done that, and you've taken it by that, you know, cliche, taking the bull by the horns and just made the changes that needed to be made. I just really appreciate that. And I think that right now for our seniors is something we all need to hear. We need to hear that as the providers that help them, but that's the message we need to be giving them too. So knowing that you're a good leader, and obviously knowing Dayton for a while now as well, I can see where that's trickling down through the entire agency. And if that's the message that they're getting when they drive up to get their, you know, their frozen meal, then that's the message that needs to be heard. Because I've had a couple of experiences where, you know, that minor contact of just having that pass off, even just that simple thing, has such an important impact. So thank you guys for what you're doing. Really appreciate it.
I really appreciate the comments, appreciate that. And all three of us, Dayton, Erica, and I have all had the pleasure of being able to deliver food directly when we're trying to adapt. And that is consistent with what we've heard. People need to be connected. Thank you, Wendy.
Thank you so much, Wendy.
Are there any other comments? Hearing none, thank you so much. And we're going to move on to Peak Vista Audiology.
Hi, can you hear me?
Yes.
Oh, okay, great. I'm Dee Hilton from Peak Vista, and believe it or not, this is my very first Zoom meeting, so forgive me if I'm not real Zoom savvy at this point. It feels very weird talking to a screen and presenting sitting down. So ours is a pretty simple program. We offer audiology. Oh, I forgot to tell you who I am. I'm the operations director for Peak Vista's Lane Center at UCCS and Divides Family Health Center, and also the director of audiology services that are offered at both centers. We offer hearing exams, hearing aids, and fittings to El Paso, Teller, and Park County residents, 60 years and older. These services are often out of reach for seniors due to lack of insurance coverage and the high cost of the services. So far this grant year, we were able to help 135 patients with 345 visits and to distribute 102 hearing aids to 52 clients. A really exciting development this year was that we had a portable audiology booth donated to us by Community of Caring in Cripple Creek. We were able to start providing services at our health center in Divide, allowing us to better serve our rural population. It made it so much more convenient for them. I was able to meet with multiple agencies in Park County and let them know of our services in Divide. And after we started offering them, once a month is what we were offering. We had 33 visits from Teller County residents and 18 from Park County. So that was a dramatic increase from years past. Of course, the biggest challenge we faced this year has been COVID-19 due to audiology not being considered an essential service. So we were forced to close those services down. We had to discontinue in mid-March, and then we were able to resume with safety modifications. Even with this major challenge and being closed for 2 months, we exceeded our budget in all areas except for new clients, and we were only under by 15. So I just think that was an amazing accomplishment with all that we were facing. Mary Ann, our audiologist, was extremely proactive in researching best practices for audiology services during the crisis, and she was able to put safety measures in place so we could start seeing patients earlier than we thought we would. and we're able to resume in mid-May. Screening all of our patients at the entrance of our building and being able to use the sound booth with headphones to communicate allowed us to maintain great social distancing and offer a safe environment to our at-risk clients. Another big challenge is that our audiologist has retired and our program coordinator moved away. So we're in search of staff who will be as passionate about this program as those two were. 40 clients remain on the wait list since services were delayed due to COVID-19. And PPACG so graciously offered to allow us to use remaining funds for COVID-related needs. And that allowed us to help our entire senior population with access to medical visits and behavioral health visits. So even though this has been an incredibly challenging grant period, we're committed to doing all we can to continue to offer these invaluable services to our community, including changing the way we provide those services so we can maintain a safe environment. And we are just so grateful for your continued support. Thank you. Are there any questions?
Do we have any questions from the members? Well, thank you for giving us an update. We know how important your services are, and we're happy that you were able to get back online pretty quickly. That sounds good.
My name is Chris Larson. I'm up on the committee, but I am from Park County. I grew up with a mother with hearing aids my entire life, and the services, the problems that it represents, there were jobs she couldn't take because it would ring when she put her phone against her ear, and the advancements are incredible. So it is a service I am very, very supportive of and really appreciate that you're out there doing that work. Thank you.
Are there any other comments? Questions? Well, thank you for being with us today, Dee.
Thank you.
We're going to move on in our agenda then. We do not have a report from membership, but the SRS committee. Jen, do we have a report? An update?
We do. We met in June, actually just last week, and had the opportunity to review the blueprint document that was created by Melissa. This document is really gives the highlights of all of the areas that the Area Agency on Aging is working on through their strategic plan. So what we were able to put together based on this long list of items is that there are really three main areas of focus where we're going to start using our study and review resources, but to really kind of look at that from the lens of services that could overlap and potentially meet the needs of the strategic plan. The three areas that we've identified are transportation, legal and education, and case management. So those are the three areas of focus that we're really going to work on to help with the Area Agency on Aging, putting together products that will support their strategic plan.
Okay, and so do you have another meeting scheduled, or?
We do. Our next meeting coming up will be in September. And we did have a few action items come out of our last meeting that will carry over to that September meeting, and we'll give another update then.
Sounds good. Are there any questions for Jen? Hearing no questions. Next is the rec chair report. I think the only thing I wanted to mention, and I think others of you were participating in this, is we, many of us on the committee or as maybe as volunteers to the area agency, delivered some yellow books this past week or so. And I just want to sort of reiterate what it's been described. I've volunteered at, at the agency for over 5 years, and I am missing that social contact and that purpose, etc. So driving around the neighborhoods to the homes of seniors and dropping off that yellow book. Sometimes it was just, hello, here's your yellow book, thank you, you know, and so forth. And sometimes I remember in particular one woman, she wasn't able to come to the door, so I called her and we probably had a 15-20 minute conversation just because she needed to talk, you know, she needed to talk to somebody. So I don't know other people's experiences related to that yellow book delivery, but for me it was important. And looking forward to other tasks that the agency might have that we can participate in. Any other, that's all I have as chair. Okay, let's move on to, I see there's an action item. Wendy, do we have a member that we're going to vote on today?
I am actually not aware of that. So I'm not sure if that was an appointment from one of the counties. Melissa, is that something that you know more about?
No, I don't think that should have been on the agenda. So
okay,
that's snuck through.
All right. I was looking at that going, I'm not sure what that is. But B, I will just second what you were just mentioning about that contact. I had a very extreme situation when I went to deliver my group of yellow books, and I won't go into the details of it, but it was a very emotional, very difficult situation that I stumbled into because I was there willing to take a few yellow books around, and there was an individual who was in desperate need for some help and some information, and I feel very honored, and I'll just say the word blessed that I was the person who got to be a part of that. But it really has demonstrated to me that even though we're not able to have the kind of contact that we're used to having with them and them with us and other people in their neighborhood or their family members, we cannot disregard how important any kind of contact is. You know, the simple act of walking up to the door, ringing the doorbell, putting the yellow book on her chair on her porch, a brief conversation more than 6 feet apart became something far more critical, and it was life altering. I'll just say that for both of us. And it was a pleasure. And I just don't think we can ever understand how critical even the smallest amount of contact can be for them. And so, which is why I was so impressed with what, you know, Jason and what they're doing. That simple handoff, even though it's still very limited, is just really important. Very, very important. So thank you.
Thank you, Wendy. Are there any discussion items?
B, I'd like to say this is Chris Larson with Park County again. I wanted to reassure and add something to what Jody had did a wonderful presentation on as far as what we've done with the TRS committee. I am the chair of that this year. Very blessed, grateful, have learned a lot. This is my second go around and I'm enjoying it thoroughly, but just wanted to reassure you we are detailed, looking at your reports, moving forward. The questions are important that they get addressed, as Jody stated, and so we can confidently move forward with trying to figure out our next path. So please answer those questions as soon as possible. We appreciate the detailed reports that we received and are very happy that we were able to get more funds available. But thank you again, and we're happy to support these senior events and organizations. Thank you very much.
Hey, this is Jason again. Is there a possibility I can add one more thing?
Sure, go ahead, Jason.
It really is a discussion item. What I wanted to share is something that I didn't want to have to be part of a formal conversation, but I wanted to also thank the AAA because you've been supportive in bringing something new to this community that's not actually completely new to the community, but it'll be new for Silver Key and the people we serve. And what it is it's the 5 Wishes Initiative. And so as Wendy was talking, for those of you who are not aware, 5 Wishes is a document that gives an empowerment for individuals to be able to say, what would they like when they think about their end of life planning? That we really do empower individuals to be able to say, the biggest, because many of the people I've talked with, the biggest fear has been, what happens if I lose my life and my family don't know what is supposed to happen? Or I worry that my kids won't be able to partner together in making decisions. And so what it is the 5 Wishes document is something that I think is of value. And at some point down the road, I will talk, hopefully in public comment, be able to share with you how Silver Key is stepping through this, but we're getting the designation as a 5 Wishes informed organization. So anyone who is interested in a planning document about end of life and really being open to have that conversation, I think you will find that 5 Wishes is culturally responsive. It's critical for people to understand that future and that families really do have your information going forward about what you want. And I value the fact that AAA was able to help us do this, and we'll be giving you more information as we move forward. Thank you, Bea.
Thank you.
If I might say, on the strategic plan, one of those items under legal falls for advanced care planning. So Jason, I would love to visit with you later on offline and
Absolutely.
maybe discuss how that project's going to work.
Excellent.
And Bea, I know I'm a newcomer visitor here, but I'm Peg Nugent. Up until last week was the chaplain with the PACE program, but I'm here because Jody invited me, as I am on way to being the new commissioner on the Colorado Commission on Aging to take Joe's place. I also would be very interested in seeing how I might be able to assist with the 5 Wishes. That definitely fits within the importance of expertise. And I just wanted to underscore what else has been said about the contacts. In the time I've been with doing PACE contacts in COVID, we need to understand that these circumstances for our seniors are exactly what can contribute to post-traumatic stress, isolation, no sense of the loss of sense of time, the loss of sense of hope. So again, I'm honored to be included in any way as we go forward that I can be of assistance in helping to bring greater connection. I'd be honored to do so.
Thank you, Dr. Nugent. I will set up a meeting for you and Jen to participate. I appreciate both of you helping with whatever we can do to build this. When I talked with Jody about this, I said, Jody, this as a community initiative could be one of the most powerful and important and empowering efforts for the people that we serve. So thank you both, and we will definitely include you as we step through.
Thank you for that. Okay, then we have, are there any events that we should know about? Jody, for example, aren't the some of the seminars, Medicare seminars and so forth going forward? Jody didn't hear me. Okay.
Bea, can you hear me? This is Marilyn Massey. Can you hear me?
Yes, Marilyn.
I've lost my video. I just wanted to make a comment that in regards to people wondering what's going to be the future for their family when keeping in contact and what will happen after they pass, I want to make sure people understood there is an agency that takes care of the pets. If there is someone that is very concerned about their pets when they pass on, I'll get that information to you. That may be well known within the community. I don't know. I just happen to be associated with someone that they took their pets and found homes for them. Also, if you know of anyone that is having problems with insurance issues, I'm a resource for that, having just gone through some tricky stuff with an insurance company. And I would be glad to be of service if any of the clients need help with insurance. I do have a law background. And also with repairs, I've just had 3 repairmen that gave very diverse options. And I think that our seniors are at risk when we don't know how to go about making choices. So use me as a resource if needed. Thank you.
Thank you. Well, our next meeting is scheduled.
B, it's Melissa.
Melissa?
Jody asked me to just give a heads up about the Medicare and Social Security classes that are coming up.
Okay.
And so a reminder that folks can reconfirm these dates on our website, to be checking that out, as well as Facebook. And in partnership with the Pikes Peak Library District, we have 2 classes in July and 2 classes in August. These are all virtual webinars, so people do have to have access to technology to tap into it, but we've been having a pretty good response with those. And then we have just our own classes. We have one happening today at 5:30, and then we have 2 more happening in July as well. So we have quite a few coming up. And so people who are struggling with wondering about Social Security or Medicare 101, we do have classes available for them to tap in and stay connected and ask questions and get answers.
Thank you.
Yep.
And B, I did have one other event that I wanted to mention to people. So many of the professionals that are involved with our RAC meetings will know this, but once a month there is the long-term care, well, El Paso County Long-Term Care Ethics Meeting that meets on the first Friday of each month. And the topics are always centered around some of those issues that are happening within the community. As you would imagine, COVID is at the top of that list. However, at our last meeting in June, some other issues came up that have been very concerning, mostly due to the isolation and the concern about our seniors that are in facilities right now. And, you know, I've had moments in my life where I felt alone, but they usually because I was actually alone. I mean, I wasn't around a lot of other people. But right now we have an entire population of our seniors that are in buildings surrounded by 100 people in that facility, and yet they are still completely alone in their rooms and not allowed to get out. I can see Peg nodding her head. And the topic that we had was the concern about the way that they're being treated. Yes, we know their safety is important. We know their health is, you know, at the top of the list, but Dr. McLean actually mentioned that someone that she recently had to do a death certificate on, she actually put down as part of the cause of death was extreme isolation. And and because of the urgency of this issue, the next meeting, which is going to be on July 10th, normally would be on the first Friday, but because of the holiday, it's being changed to the 10th. So on July 10th, which is a Friday morning at 7:30. I know that's early. There's going to be a much larger conversation, probably an hour to an hour and a half long. We're hoping to get some of the state representatives, you know, who are involved with the public health to be on that call as well, to have a better conversation about how this extreme isolation is affecting our seniors, particularly in facilities, that it is, they may not be contracting COVID, but they are contracting the desire to want to die. That, you know, that there's, what's the point? And it's an extreme situation that who would have thought? One person made the comment this last month that we are treating them worse than if they were prisoners of war. And that was a pretty sobering thought. And so that conversation will be on July 10th, 7:30. As soon as I get the link, I will send it to Melissa, who can then send it to everyone. I think as many people as we have involved in that from all of our perspective, not just us as the advisory council, but also providers, Jason, and, you know, Michelle, and all the different people I can see on there, that we may be protecting them health-wise on one end, but we're subjecting them to other health situations that are detrimental, almost as detrimental to their well-being. So I will get that as soon as possible, but if you would put that on your calendar, 7:30, July 10th, and I will get the link out as soon as I get it.
Thank you. Thank you for that information. I'm sure some of us, if we can, will attend, because that is an important issue.
And
Wow,
again, Wendy,
thank you for sharing that. This
Yeah,
is Chris. This is Chris Larson from Park County. Thank you so much for sharing that. Quickly, I did want to add one thing, maybe not on a lighter note because that's very important, but it is one. We have been fortunate to have an educator who is going to put together some videos, training videos on our website for Zoom. To teach seniors and people how to access, to utilize the programs and protocols. So as soon as we have those dates, I'll make sure and notify all of our RAC team and AAA and get that forward. But thank you for sharing that, Wendy. And God, anyway, thank you.
And Wendy, I'll try to reach out to you too, because I did have a lot of experience with exactly what you're talking about. And it's a delicate balance because the facilities themselves are so stressed out that it's hard, even to say, would you help me do a telehealth meeting so that I can get this person to see their family? They have aphasia, they can't just connect by phone because it's so strapped for the staff too.
Well, and I don't know if anyone else saw the article that was in the Gazette. Thank you to my mother for making me aware of it. But it was this huge article. It was about 3 or 4 days ago now about, the nursing homes across the state. Luckily, none of ours locally were mentioned, so that's a good thing. But it was pretty ugly with the comments about, that they're putting our seniors at risk. And yes, that's true. And we need to be careful, and we need to have all the protocols in place so that we're not bringing it into the facilities. However, I was able to read that article with the perspective of, yeah, but that means that no contact means that they are emotionally shriveling due to that lack of contact, and that there is another side of this. There's another issue that we need to somehow balance it between the both ends. And I don't know what the answer is, but if we can gather all of the bright, brilliant minds of our industry together, we might be able to approach the state in a way to say, but we need something. We need some way. And I know that all of my colleagues that work in the facilities, assisted, skilled, whatever level they may be at, they are terrified that it's going to be their building that will get it and then somehow infect all of their residents. And yet they're the ones that families are angry at, the residents are angry at them, and trying to come up with ways to give people some contact. They're not trained for this either. They were not experts in Zoom. They're not experts in all of this technology. And we're putting an awful lot of pressure that they're somehow supposed to figure this all out. And I just think I think we need to support them and what is it that are doing and how they're doing it, and so it can be done better. So,
well, thank you for bringing that.
I'm off my soapbox.
Right. Thank you for bringing that to our attention. I believe that completes our meeting for today. We will see you all on the fourth Thursday, July 23rd. And thanks so much for being here this morning. Bye now.
Guys, do we know if that's going to be a public meeting or a Zoom meeting?
It'll definitely be a Zoom meeting.
Okay, thanks, Wendy.
Yeah. Which is why as soon as I get the link, I will make sure we get it sent out.
Be the actual RAC meeting, is it going to be a public meeting or a Zoom meeting?
I think probably a Zoom.
Okay, thank you.
It'll likely be a Zoom meeting. We're going to be testing, this is Jody, we're going to be testing a meeting early in the month, see how that plays out. We have some capacity issues and maximum seating and minimum seating and that kind of thing. So just be listening for more. Thank you, everyone.
Thank you, everybody. Bye now.
Bye, everyone.
Bye.
Thanks for what you do.